You know, it's been said many times over and over again, if you don't have your health, you really don't have anything. The good news is that research and technology is always being developed to improve your health. Today, we're going to talk about chiropractic health and treatments and a unique treatment used by some Olympians to treat pain and injuries. Joining me now at the desk is Dr. Jeff Hedrich. He's a Lethbridge chiropractor specializing in shockwave therapy. Welcome to PCN, Dr. Jeff.
Well, thank you very much for having me, Hal. I really appreciate the invitation.
You bet.
And I love talking about chiropractic, so I'm looking forward to this.
So what are chiropractors really able to help a lot of people with?
Well, the question you're asking is a pretty large question. Chiropractic is a large profession, and it has a big scope of practice. So many of the issues that people face when they come to see a chiropractor are pain-related, and some of them are not so much pain-related, but perhaps nutrition-related. So there are multiple types of barriers that we try to address to improve the healing.
I know when I had my car accident many years ago, about 6-7 years ago, chiropractic treatment helped me a lot, keep the spine properly aligned. That's pretty important, isn't it?
Absolutely. You know, we're walking around in an upright in a gravitational field, and just the sheer wear and tear of gravity and time on our bodies takes its toll.
How important is chiropractic treatment when it comes to helping somebody with migraines, constant headaches?
Migraines are a very debilitating disease, and I guess you could call it a disease because there's many factors that underlie these conditions. I read at one time that there are about 80 causes for headaches.
Wow.
And so it's pretty hard to pinpoint any one issue, but chiropractic does have good success with certain types of migraines.
So what would a patient expect to take place in their very first visit with a chiropractor? You do an assessment at that point in time?
Exactly. We like to do a thorough case history. So we're going to look at the familial history or the history of the present illness. We're going to look at the type of onset that they've had with the condition. And we're probably going to get into some examinations, a little bit of testing. We call it provocative testing to see if we can reproduce some of the symptoms.
Some people I speak to, they say, I'm not going to go see a chiropractor. They're going to snap my neck, crack my neck, and they get a little nervous about it, right? I'm going to be paralyzed, you know, I can't leave the office. So how do you put people's fears at ease, Dr. Jeff?
Well, that is a great question. I'm not sure that I have the best answer for it at all, but basically I talk to people about their problem. And I'm concerned, you know, I've had my own issues and I like to identify with them and let them know that I understand their fears, their misconceptions, maybe some of their misgivings and things like that. And then we just talk about the options that we have for treating it. And of course, I always explain the process that I'm going to do and make sure that they're comfortable with it before we proceed. And in most cases, people realize that they can't go on the way that they're feeling now, and that they have to go through a little bit of a treatment to get the issues resolved.
When we're driving a car, we can always tell if our vehicle needs a realignment. You know, a lot of times the tires are going bald on the inside, the outside. You need a realignment. How can we tell with our body when we need a realignment?
Another great question. Some people wait till the point that they have pain. Pain, there's no such thing as a good pain, we'll say that for sure. It's definitely a warning, but it's not the actual problem. So you really have to get into measurement to find out if there is something going on in the person's body.
So how can you really help when it comes to the manipulation, when it comes to a person's back, like the lower back, the central part of the back, and the upper back?
Depending on what type of a procedure that the chiropractor is using, we can treat just about any area, maybe not necessarily from that area, because we look for other restrictions to the function and perhaps some other tissues that are involved that have a referred pain or projection of pain. So we do get in there and we can treat manually with the manipulations or soft tissue treatments. There's a lot of types of chiropractic out there, and they can address a big variety of issues.
Can chiropractic treatment also help with irritable bowel syndrome?
Yeah, that's a great question, and I think that the answer is probably. There are quite a few issues that are related to that in the spine, and not every one of them, I'm sure. And that's the nice part about chiropractic, though, is that, you know, anything that's related to the spine is definitely going to get better, and anything that's not related is still going to be persistent afterward. and it helps the people sort out some of the causes that they may have for those issues.
So explain to our viewers then, Dr. Jeff, how you incorporate shockwave therapy into your treatments.
Well, shockwave therapy has been a transformative procedure in my clinic. I didn't know that there was so much that I wasn't really good at until I got that into my office and started working with multiple conditions. So now I'm looking at a lot of people. Well, I used to have people come to my office and they'd come in for a specific problem, but I'd notice that they'd also have knee or hip pain or an elbow issue, and I didn't really have a great treatment to offer them. And then once I got the shockwave therapy in there and started using that, I found that I could treat a lot more conditions. So I'm always on the lookout for what type of a problem a person has, and of course, you know, trying to get the word out and let people know about what shockwave can do has brought in a whole new bunch of people to the office. So
And Olympic athletes have used this as well with some of their injuries.
Yeah, there's a lot of athletic application for this type of a procedure, and pro sports, they're using this extensively. Now they travel with physiotherapists or chiropractors and sometimes even their own personal physicians, and they use all types of modalities out there, but shockwave is becoming very, very prominent out there.
So how does it actually work then, doctor?
Excellent question. Shockwave therapy was actually developed to break down kidney stones while they're still inside the body.
Wow.
So this high pressure acoustic wave can penetrate deep into the tissue. And what it does is it recreates the initial stages of the injury. And those initial stages are what signal the body to start the healing and repair cycle. So they have different chemical signalers in them. They also help to stimulate new blood vessel development, change the metabolic activity of cells, and generally work with the body's own processes to enhance and promote healing in the area.
So what actually changes in the body as a result of the acoustic waves that are being administered to us?
Yeah, that's a really good question. Well, basically it's just kick-starting the body's healing cycles. The body has certain reactions to different type of forces that are introduced to it. We know that a pressure wave coming into the body will stimulate new blood vessel development. We also know that the bones in the body respond to the stresses of standing, running, and jumping, and that high pressure wave can be brought in there to improve the turnover of the bone cells, which makes it stronger. Also, there's a big influence in the lymphatic system. The shockwave is able to gently press out that lymphatic fluid, and that is a big promoter of healing, something that's not as well known as it should be.
How long does a shockwave treatment generally take, and is it painful?
Yeah, this is a question I get all the time.
Right.
Shockwave is not necessarily a pleasant experience. It does have a little bit of an ouch factor to it.
No pain, no gain?
Right, very true, no pain, no gain.
Right.
And in fact, we want a little bit of a pain because pain is another signaler the body uses to alert the brain that there's a problem with the tissue. And of course, the brain is what's going to react and coordinate that healing and repair in there. So yeah, it's a little bit of pain is helpful, but you only have to endure it for about 5 to 7 minutes.
And how many treatments would you suggest somebody undergo when it comes to shockwave therapy?
Well, this is the art of treating anybody and their condition, and all that is based on a number of factors. It could be the age of the person, it could be the duration of the complaint that they've had, the severity. So many factors go into there. We try to start out with a rule of thumb. If a problem is pretty new, I like to start in a 3 to 5 range. But if it's chronic, it could be 5 to 8, maybe 10 or 12 sessions to get some good results out of that.
Do we have any studies as well about potential side effects down the road?
There are studies out there about side effects, and this is where we like to alert people to the 2 different types of shockwave therapy. There is a radial shockwave therapy that is a pretty low pressure level. And that pressure level is really not capable of producing any damage in there. And then there's a focused shockwave therapy, which is a very high level pressure, and it has some potential to produce some hematoma and something inside of like a blood clot, or not clot, but pooling of blood within a tendon.
How about carpal tunnel syndrome? We hear that quite often. How can you
Carpal
help
tunnel.
people with carpal tunnel?
Carpal tunnel is probably my least favorite condition to see.
Do tell. Do tell.
It's stubborn. I don't know. There must be multiple factors involved in this condition. I see some good results with adjusting the wrist. We restore the arch into that carpal tunnel, and I don't use SHOCKWAVE on it. I have used acupuncture and had some good results with it. But the severity of that condition sometimes leaves a person with no other option than surgery.
Wow. Now, how about proper posture? How important is that?
Well, I'm glad you reminded me of that because I'm sure that I've been slouching a little bit.
And mom's
myself.
probably watching, right? Come on, son.
Yeah.
Stomach in, chest out, head back.
Yeah.
But how important really is that to overall health?
It's a really great question. There are really two types of posture that are happening in our body. There's one that's subconscious that we don't think about, and that's really an alignment posture. And that has to do with the function of the spine and the health and the position of the vertebrae. And then, of course, there's our conscious posture that we can think about and correct ourselves. And I think it's very important because now we're seeing the arrival of a lot of conditions such as text neck, people sitting like this, texting too much,
Text neck, right.
or gamers. And they're getting a curve going the wrong direction in their neck, and it's producing a lot of downstream health problems and possibly even damage to the spinal cord and the cervical spine.
Would some of the nerves be pinched as well, perhaps?
They are interfered with, not necessarily pinched. They can be tractioned or stretched.
Okay.
And so can the blood vessels in the area and produce what we call an ischemia, which is a lack of blood supply. And of course, anytime we lose blood to an area, that's not a good thing for us.
What about pillows? Some people love the big fluffy pillows, filled, down-filled pillows. Other people say, I need the chiropractic foam pillows with the curvature of my neck and my head. What do you suggest? What do you recommend? Or is everyone different?
Yeah, excellent question. Pillows, I don't know if there is really a firm answer to the pillow, hard or soft. But I caution people to use the curved pillows as more of a therapeutic treatment. Not necessarily something to sleep on, but something that you can use to help restore the curvature in the neck. And then when we're sleeping at night, we're probably going to shift it into an odd position anyways. So the pillow really comes down to a trial and error type of an issue.
How about when it comes to footwear and shoes, proper footwear? Should we use orthotics? Some orthopedic surgeons I've spoken with in the past, Dr. Jeff, they say, no orthotics, bare feet is actually the best route to go. In and around the office, what are your thoughts?
Well, this is an excellent question, and that is a really important issue to look at with a person. I do see people who have some arches that are collapsing and they need the support. And then there are other people who don't have that problem, and of course they don't need the support. So the question really becomes, do we want to create a crutch in there, or do we want to try and rehabilitate the problem back to a natural position? Preventing the fall of the arch is important, and I think bare feet's a little bit better to prevent that than other type of footwear.
So if the arch has already fallen, it's too late?
Probably too late, and it's going to need some support.
Gotcha, okay. How about proper diet, vitamins, and supplements? How important are they for our overall back health?
Well, we can look at it certainly for our overall health, and certainly our spine too. Anytime we encounter an injury, we have to have the proper nutrition to heal and repair that. When you're going to go build a wall, you need to take the bricks and mortar with you, otherwise nothing's going to get done. And I didn't used to put too much emphasis on this in the past until I met a chiropractor who had been working through the 50s and 60s.
Wow.
And he said to me, you have no idea how much of a struggle you're facing right now. When we used to adjust people, you could almost raise the dead because the only barrier was the physical barrier of the spine. They didn't have a nutritional deficit. Now we have depleted soils and chemically manufactured foods, and these are all not providing the nutrition that we need for proper healing and repair.
Dr. Jeff Hedrich, Lethbridge chiropractor specializing in shockwave therapy. Thanks a lot for joining me today on Bridge City News.
Thank you very much, Hal. I appreciate it.
On behalf of all of us here at BCN, I'm Hal Roberts. God bless and have a great night.